What you can see behind you here is the Billy Reardon Memorial Clinic. When I first came here in 2000, this was a greenfield site, and I discovered that there was no medical treatment in the village, and I wanted to do something in memory of my son. So in 2003, we managed to get the first building up and constructed, and in 2004 we opened the clinic. The second building, which is parallel to this one, is our inpatient care facility, and the building that you can see over there amongst the trees is the Ward Cromer building. That houses the HIV clinic. In the 14 years we've been here, we have managed to develop on a very regular, steady basis, and now we run probably the best clinic in this country, certainly the best rural clinic in this country. We see about 120 patients a day in the outpatients department, and about 100 and over 100 patients a week in the HIV. They are new patients, plus 1,200 patients attending every month for ARV treatment. I think it's very safe to say that without this clinic, this village would be like many other villages in the area, would have absolutely no medical care. There was none there when I came. There is still nothing other than our clinic, servicing about 16,000 people. Ward Cromer came here, and I think he was very surprised at what an integral part of the village this clinic is. And he was particularly interested in our HIV program and was very anxious to continue to fund it for as long as possible. We're very grateful to him for the donations he has given us up to now, which has enabled us to put up this building, and we just hope that in spirit Ward will be with us and that he will be able to continue to support us for in years to come.
Yeah, indeed, my name is Emmanuel. I'm a patient care attendant. I'm a Cape Macquarie citizen. Yeah, on behalf of my fellow villagers, we do really appreciate for this great development of this clinic, because to go to Monkey Bay is very far, so we were losing many villagers from Cape Macquarie. So we really appreciate for the great development that Max brought in our village. Thanks a lot. Yeah, honestly, we can say also the clinic is giving chance like job opportunities.
Right.
Some people have access to jobs because of the clinic, and also we have the ART clinic, which also helps a lot in terms of HIV and AIDS. Yeah.
I've been working here about 10 years and 10 months now.
10 years and 10 months?
Yes.
And how did you start?
I started like a patient care attendant
in
2007, yes. Yeah.
And then?
Then in 2009 is when I went for a training of HIV testing and counseling.
Yes.
Yeah, so it's when now I was doing testing and about HIV and also about STIs, and giving medication about HIV, that is ARVs, to the patients.
Right.
Yes, yes, yeah.
And how many people do you test a week?
We normally, in 1 week, we test about 140. So that comes positive about 10 to 15.
Okay, so that's quite a high percentage.
Yes,
of
yeah,
people.
yes.
And
yeah.
then you start them on ARVs straight
Yeah,
away?
nowadays there's what we say 90, 90, 90.
Yes.
Once a person is positive,
yes,
the same time a person needs to start on treatment.
Right.
Yeah, this Billy Reardon clinic has employed many staff.
Right.
Yeah, we are about over 40 or over 30 something.
Yeah, that is a lot.
Yeah, oh, yeah, because it's not just by health facilities that people are getting, but also the clinic is helping us to earn the living.
Yes.
Yeah.
Yeah, my name is Wilson. I work here at the Billy Reardon Memorial Trust, and I've been working for the past 13 years. My responsibility here, I work in the lab as a microscopist, and I've been in the lab for almost 10 years now. That means I have an experience of 10 years. So what I do in the lab actually is I do mainly it's malaria and TB slides. And in malaria, actually, we do malaria rapid test. That means when a patient is coming for the first time, we test for malaria MRDT. Then, when it's positive, then we take lab as anti-malaria first try and drug. Then, lab is supposed to take for 3 days, and after taking 3 days, maybe the same patient is coming here for having same symptoms. Then we cannot do with MRDTs because it will still detect positive. So what we do, this machine is very important because we actually see the real actual parasite now. Then we do the BF blood film with this machine to see the actual parasite, because MRDT will just detect the antigens of malaria. And what I do again is TB slides. So we know there are many methods we're doing TB, but what we are doing here is only zero Nelson method. That's the ZN. Yeah, zero Nelson method. Zero Nelson, that's the one who introduced that method. So that's the only one we do here. Yeah, there's still, because in the village there's this infection as well. Because maybe at the quarter we can find maybe 10 people. That means there's a lot of infection. Because not many they are coming at the clinic, but if you are doing if you are having that such number, that means there's a lot of that infection in the village. You know, this infection as well is very dangerous. As let's say when one is positive in HIV, and when he's taking that that therapy, ARVs, with this infection, that medication cannot work without treating this TB, without treating this bacilli TB infection. That means TB is very important to know the one that who is TB. That's why. So that's what I do as well. So we're also doing a urinalysis, urine check in pregnancy and some other infections. Yeah. I also do the blood level check, that's hemoglobin check, with this machine. Yeah. Especially when we have children with lower blood. So it's nice to check with that machine. Yeah. That's what actually I do.
I am Linda Jali. I'm one of the workers at Piles. I've been started working as PCA, patient care attendant, and then I've been working as PCA for 8 years, and now I'm changing my position. I'm HIV diagnosing assistant. I also work as STI, sexual intercourse transmitted disease, as one of the counselor. I also work as HIV medication, which is to help people how to take ARVs. Yes. This building is helping in the village just because at last we are having many funerals in the village.
Yes.
People are struggling where to take ARVs. But now they're just walking from the village to come here to collect their medication. When the patient is having high viral load, it's easy to get her or him.
Yes.
Sure.
The difficulties of the other communities up and down the lake who don't have clinics like this, do you think that you can see the difference in the health of the population?
Yes. We have so many villages where they are struggling having medication like this.
Yes.
Yeah, we see some people from other communities like Nankwali,
Right.
Kasanka, which is not in our village.
No.
Yeah.
But they have nothing there.
They don't have.
Like Billy's had nothing 14 years ago.
They don't have like here.
Right.
Yeah.
So it's really a community.
Yeah, it's working. Yeah, it is helping in our community a lot.
Yes.
Yes.
Well, thank you very much. Is there anything that you think we should know, or do you think that people, friends of Ward, who've donated to this clinic, that they should know that's important?
Yeah, it's very important. Much thankful from one of us, like myself, to the people who are funding us, because they are doing a great job. They should keep doing on that.
Oh, my name is Sofina Matewere. Yeah. I'm working here for 14 years old.
From the time it started?
Yes.
From the beginning?
Yes. Sure.
And is it a good job?
Oh, yes.
Are you happy?
I'm happy. Yeah.
Oh, thank you very much.
You are welcome.
Nibereka moni kwa bale wanga kunyamba deko mukupesa bwanji Nibereka moni kwa bale wanga inu kukasungu kodi muli bwanji ine kuno mukundimva inu chikalileni wa moyo tsono wa moyo tsono koma imodzi yikundivhura inu ine kana nithandisa aba koma imodzi yikundivhura inu koma tsono kwanitandita ine ya mama abale amama ndilini mavuto mai wanga kumeneko tsono muli kundimva abale ndilini mavuto tsono ine kumene mulili mukundimva amama ababa amama Moni no senu, moni o, moni abale, moni, moni kumene mulili, moni, moni kumene mulili, moni o, moni wanga u, moni ne, moni ndi nyama ya njofu, moni o, moni usabelebele, moni, no senu, moni usabelebele, moni, no senu, moyo kayankurauni, moni, no senu, moni kayankurauni, moni wo, no senu, moni abale wanga inu, moni, no senu, moni kayamukundimva, moni, no senu, moni kayamukundimva, moni wayisangalalo, moni ndi wachimwemwe inu, moni kwa abale, moni, no senu, moni kwa abale wanga.